parang naputol yung intro po natin. Do you want to play it again? Thank you so much. Nagkakaroon po tayo ng connectivity issues, but we are happy to be with you today. It's a Tuesday, and pag-uusapan po natin is booster doses sa COVID bakuna. Kailangan na ba? Okay? So, magandang umaga po sa mga bago. I'm Dr. Ana York Bondoc. I am a pulmonary and critical care specialist. I am also po a 3-term congresswoman at nandito po ako ngayon sa San Juan, San Luis, Pampanga. I'm also the mom of Benji. Nag-online class po yung bata. So, sisili po muna tayo ngayon to do a live. Masyado po bang matapang yung red? Guys, palitan nyo na lang into purple or something, okay? So, but it's very serious discussion po ngayon. And we are talking po about booster doses po ng COVID bakuna. Yes. Maingay po ang ating electric fan, so I hope this will help. Luminaw na po ba ang sounds? If it's okay, please put a thumbs up or a heart. So, sobra pong magaling po yung ating bagong microphone, lahat po nang napipick up. So, okay na. So, a backgrounder on the COVID boosters. I was the guest po at the Philippine Foundation for Vaccination po with some of the most eminent immunologists and infectious disease specialists po sa bansa. Among them, Dr. Emma Lianto, an adolescent pediatrician, Dr. Jean Soliante, member po ng vaccine expert panel, si Dr. Eric Tayag po ng DOH, Dr. Lulu Bravo, Dr. Wilda, vaccine expert panel din po, and Dr. Tina Alberto last Saturday. The video po is below. Kaya lang po, there was a lot to talk about, so hindi po masyadong na-focus, and I wanted to discuss more about the booster doses. So let's do it today, and we're willing to answer po all questions. So lagay niyo po yung questions sa below. YouTube, we are live. Please follow us also there, and do please follow us kasi nagpaparami po kami ng mga sumusunod. So tara na, before lunch, let's talk about kailangan na po ba ang COVID booster shots. Okay, question number 1. Doktora, what's a booster shot at bakit nga ba may booster shot? So, ano nga ba booster shot? Ito kilala to sa mga sa mga pediatricians. That's why I was actually with a group of pediatricians last Saturday. And upon further research and listening to them, the booster shot po, yun ang extra administration of a vaccine after the first primer dose. So, assuming po, ang first requirement, syempre, dapat nabakunahan ka na first time, and then the second shot after usually many years is considered po the booster shot. So, ibabakuna po sa inyo yung antigen muli. Kasi parang the premise is, sa katagalan na po ng panahon, bumaba na po ang immunity nyo, your antibody levels went down, and secondly, yung memory po, mababa na po yung memory ninyo. Or mababa na po yung memory ng inyo pong B cells and T cells, and they cannot produce antibodies as so fast. So, we vaccinate the antigen again. Okay? Pinapasok uli yung antigen sa katawan po ng tao, and then magre-react na naman po yung inyong katawan, and then parang marirefresh kumbaga yung memory. Nakita nyo na naman yung bad guys, or nakita nyo ng katawan nyo uli yung magnanakaw. And that's why we have what we call booster shots. Okay? Usually po, yung binabakuna is the same. It's the same antigen as the previous. Okay? So these are what we call booster shots. Or re-exposure to the immune antigen after the memory has declined. So usually, it happens po after many years. At pinag-aralan po itong mabuti ng mga scientifico, and thus, they know that we need booster shots. Okay, next. Ano ang mga bakuna na nangailangan ng boosters? One of the most well-known po is polio. We do booster shots po for polio. Yun po yung IPV yung tinatawag. In less well-off countries, we give the oral polio vaccine, but they do give booster shots po for polio. Tetanus is probably the most famous. Doon na lang po tayo sa tetanus kasi talagang this happens to us frequently. As you know, every 10 years po, you need a tetanus booster shot. And that's why po, kung sakaling naputukan po kayo ng firecrackers, or you sustain po a wound sa kalawang, or if you are a farm worker, or you are a construction worker, pag kayo po ay nasugatan and you go to the emergency room, hindi na po nila uungkatin kung kailan po kayo huling nag-tetanus vaccine. Agad po, babakunahan po kayo ng tetanus booster shot. Kasi it is presumed na lumipas na po ang 10 years. It's usually 10 years po for tetanus. So, in an emergency situation, if you're in the emergency room or may nangyari po sa inyo, wala na pong tanungan, bibigyan na lang po kayo ng booster shots. Okay? So, ang binibigay po sa tetanus, it does not include the pertussis. So, parang diphtheria and tetanus po ibibigay sa inyong booster shots. For pregnant women, kasi po, lalo na po in developing countries, yung neonatal tetanus po is very, very common. So, they give booster shots po to pregnant women of the tetanus vaccine. Okay? Sa whooping cough, they also give po booster shots. What are examples of vaccines that don't need booster shots? Hepatitis A and B po for life na po yan. Those are vaccines that are for life. Okay? Next question po. Puntahan po natin yung flu later, no? How do we measure kung may immunity pa tayo sa COVID? Yan ang napakaganda pong tanong. How do we know that we still have immunity from COVID? Now, most of the people po, they measure the antibodies through the blood. Yes, we can measure antibodies through blood. And nakikita naman po na bumababa po yun. But again, experts in infectious disease say that even though your antibodies may be low, it doesn't mean that your immunity is low kasi po may memory pa po kayo. How to measure memory? We cannot quantify memory po eh. So talagang it comes from the memory B and T cells. And what's the meaning of the memory? Kahit mababa po yung antibody nyo, pag nakita po nung memory cells na may pumasok pong COVID sa katawan nyo, the memory cells can automatically give messages and say, andyan na po yung bad guys, andyan na po yung kalaban, andyan na po si COVID, gawa na po tayo ng antibody. And the body can instantly po make many antibodies. So yun po yung purpose of the memory cells. Okay? So, next question po. But right now, there's only one way we only measure antibodies. We do not measure po memory cells. So, that's really a very good question. Is how long po will the memory of the B and T cells last? And nobody can answer that question pa po ngayon. So, useful pa bang magpabakuna ng antibody titers? It is not recommended po to measure the antibody titers. In fact, I have not done that and I don't recommend it to anyone. Though alam ko may mga curious dyan po. Baka manervous lang kayo pag mababa yung antibody titer nyo, pero you don't realize that you have memory cells that can produce antibodies in an instant upon exposure po to COVID. So I would say po, makakagulo lang po yung measuring the antibody titers at baka magka-nervous po kayo and that you might seek other remedies like magpabakuna ng booster, yung pala okay na okay naman po yung inyong immunity. And kailangan pa ba ng booster shot sa COVID? My answer po to this is, napag-usapan din po noong Sabado with the experts, is hindi pa po, no? Right now, our vaccines, what's the purpose ba of the vaccine? The purpose of the vaccine is to prevent severe COVID, to prevent hospitalization, and to prevent death. Sa lahat po ng mga bakuna natin, nakikita po talaga na yung mga na-ospital, yung mga namatay, recently na lang po, yun na ICU talaga sa Pilipinas, yun po yung mga taong hindi po bakunado. And worldwide, this has been shown. Most of the people who've been hospitalized, who have passed away after vaccines, and in the ICU, these are the people who are not vaccinated. So, yung COVID vaccines is actually doing their job. Kasi yung COVID vaccine was never meant naman po to prevent all the COVID. Meron at meron po talagang mangyayaring COVID even in the trials. Kasi po, our end goal was not really para never na ho tayo magkakaroon ng COVID. Talagang there will be breakthrough infections because even in the trials, it was not it was not 100% protection. Pero ang goal po talaga ng mga bakuna is 90% protection against hospitalization, death, and severe COVID. And right now po, all the vaccines, even against the Delta variant, are doing that. So nakakayanan pa po ng ating po mga bakuna yung severe hospitalized and death from COVID. So the vaccines are actually still doing their job. So sa Pilipinas po, nag-agree po yung mga vaccine experts, it is not yet a necessity. It's not yet an emergency. And hintayin pa po natin ang further science and further recommendations regarding booster shots. Okay? So yun po, question about booster shots. Do you need booster shots at this moment? My answer would be no. You don't need booster shots if you have a normal immunity po and you receive 2 doses of your vaccines. No need for booster shots at the moment. Pero you still need to wear a mask. You still need to wear a face shield and socially distance. And most importantly, you have to just wait and see na lang po tayo kung ano po ang magbabago kasi science changes every day, every hour, may mga bagong discovery. Nadidiscovery po ang mga scientifico. Pero to rush forward and get yourself vaccinated without the advice of the government, hindi ko po masasuggest yun. So booster shots, ang sagot ko, hindi pa po rekomendado. So sa inyo po lahat, I hope you have a good morning. And all questions, welcome po.
Doktora, ano po ang status ng tetanus vaccine? Dapat ba may boosters?
I kind of discussed this, pero sige, let's go again. Ang memory talaga ng tetanus has been shown to go down over time. And of course, we all know po na ang tetanus, once you get tetanus, halos diretsong patay ka na talaga. It's really a difficult disease. So, after 10 years, it is recommended talaga that you get a booster shot of tetanus. Ngayon, when you go to the ER, hindi na ho nila itatanong kung nabakunahan na kayo. Automatic bakuna na po yon. Kasi ang hirap pa ng usapan kung kailan po yung huling bakuna nyo ng tetanus. And I'm sure most people do not remember. So, for accidents and things like that, diretsong bakuna na po para you get a booster shot of tetanus. So, yes, tetanus is one of the most famous vaccines that needs boosters.
Doktora, bakit ang flu yearly?
Technically, people ask me, booster dose ho ba yung flu? I mean, eto po kasi I studied it, booster, extra administration of the first of the primer dose. Yung flu po, hindi siya booster kasi hindi ho pareho yung binigay sa inyo It's a different strain because the flu mutates or there are different strains. They called a shift and a drift. Sa flu talaga, yung flu last year, hindi yun yung flu this year. So yung bakuna last year, hindi po yun yung bakuna this year. So technically, hindi siya booster shot kasi naiba yung linagay sa loob. Kasi A1, A2, B1, B2, kumbaga pumipili po sila ng different strains at yun po yung linagay last year at iba po yung linagay this year. So technically, parang hindi siya booster shot. Bago shot siya talaga. Kasi yung protection mo last year, hindi na siya magpro-protect this year.
Okay, from Ms. Mondo Santos. Doktora, magpapanyumococcal vaccine kami ng wife ko for life. Okay po ba yun?
Ang pneumococcal vaccine po is also recommended. Let me check. Ang alam ko po is every 10. So, and also, if you have been vaccinated po with pneumococcal vaccine at a younger age, lalo na po kung kayo po ay with cancer, yung mga ganun po, and you were vaccinated at a younger, wait lang, I'm checking. If you were vaccinated po at a younger age, you need to be revaccinated once you reach senior status. Okay? So, yun po yun. Yes, you will need pneumococcal boosters. Ayan, nakalagay po dito, younger than 2 years old, 4 shots. If you're an adult, 65 years or older, 2 shots which will last you the rest of your life. But if you got it before 65, you may need to repeat. So, consult po yung doctor nyo.
Okay, next question from Mr. Salonga Jeffrey Olina. Doktora, importante po bang magpa-vaccine kung
Ay,
yearly?
wait lang. Ang sorry sorry ma'am, I'm sorry also Miss Rina for there are certain conditions that need the pneumococcal vaccine every 5 years. So consult your doctor po.
From Mr. Salonga Jeffrey Olina. Doktora, importante po bang magpa-vaccine kung yearly po?
Sorry, parang Jeff, my question to you, what vaccine are we talking about? Is this COVID vaccine? Is this flu vaccine? Puntahan na lang natin si flu. Yes, it is important to get the flu vaccine yearly. First of all, lalo na ngayon, no, we don't want to go to the ER because of flu. Sa US po, it is highly recommended sa mga healthcare workers, those po na halimbawa may edad na po kayo, mahina po yung immunity nyo, it is really, really recommended to get the flu vaccine yearly. Ngayon, kung healthy naman kayo, it's still better, pero hindi naman ho ganun kalakas yung push for the flu vaccine. But yes, it is important to get the flu vaccine yearly. I hope I answered the question, Jeff. Kung mali yung pagkakuha ko po ng tanong, please put it down, okay? Kasi baka you might be asking me about the COVID vaccine, so pakilinaw lang. But I'm just giving you the flu vaccine yearly. Okay? Next po.
From Ms. Loida Gutierrez, pila niya pong years ng effectivity ng COVID vaccine? Thanks po and God bless, Doktora.
Ma'am Loida, at the moment, nobody knows the answer to that question. Nobody knows the answer po to this question. So I think we just really need to get ourselves vaccinated twice. Continue to wear our mask, face shield and socially distance. And the next step is just wait lang po sa mga experts. Huwag po tayo mag-alala, mag-worry, mag-try ng sarili natin, sumiksik sa ibang LGU po para magpa-booster dose. Hanggat hindi pa po sinasabi ng gobyerno, don't worry about it. If you have 2 vaccines and you're wearing a mask, okay na po ang inyong sitwasyon as of the moment po.
From Ms. Mercy H. Fernandez, Doktora, need na po bang magpa-tetano vaccine now, even if walang nangyaring accident the like?
That's a good question, Ma'am Mercy, no? Wala naman pong masama if you'd like to have a booster. Okay? If you'd like to have a booster, I do not see any problem with having a booster po of a tetanus vaccine. Kwento ko na lang sa inyo what happened to me. When I was 26 years old, I was skating po, no? I was in ibang bansa. I was in Central Park. I fell into a drain. Okay, I'm not a good skater. So, umiiyak po ako. I was walking towards the hospital where I work. Kasi wala naman ho akong magulang sa US. So, parang bahay ko na rin ho yung hospital. I was walking into the ER, naduguan po yung aking paa. So, I saw my best friend who's now an ear, nose, and throat surgeon. And akala ko parang aasikasuhin yung sugat ko sa paa. Hindi. Without even asking, he grabbed the tetanus and stuck it in my arm. I was like, aray! Oh, well, okay, I was in the US, so I yelled, ouch. But basically, ganon, that's how I got my tetanus booster. So that was the age of 26. I think I got boosted when I got pregnant. And then, lately po, nahulog ako sa bukid, I had another tetanus vaccine. So, I would say I'm good for another 10 years. But if you wanna have a booster, kahit walang nangyari, it's okay. Wala naman po masama.
From Ms. Cindy Abinas Cantillo, good AM po. Just in case po on the second dose, ked ay may ubo pa sipon. Pwede po bang paturukan on that day? May rescheduling po ba?
That is a very good question, Ma'am Cindy. And I would like to add another question to that later on, okay? So, kung meron po kayong ibo at sipon on the second dose, you should not line up. Kasi po, one of the questions there is, may ubo ba at sipon kayo? Baka ako, you might have COVID kasi ang Delta variant ubo at sipon. Kung wala naman po, hindi pa rin ho kayo babakunahan, you'll be sent home. Kasi if you do have the Delta variant, baka may mahawa pa ho sa inyo doon. So that's the first reason. The second reason is, hindi rin po kayo dapat bakunahan kasi some people, lalo na the Pfizer and Moderna, mas malakas po yung kanilang side effects for the second dose. So baka ho maghalo yung ubot sipon at saka yung side effects, mas grumabi pa. So people really recommend na you are feeling well before you go to the vaccine kasi either matitest kayo ng COVID or baka ho maghalo yung side effects. Okay? So, yun po, that's the reason. Sorry. When should you be vaccinated for the second dose? As soon as you feel better, pa-reschedule na po kayo, ASAP na. Okay? ASAP na po. Kasi baka, ito lang kulang ang mga doses sa Pilipinas. So, baka ako makulangan kayo ng dose. Of course, the LGU will try to find, pero mahirap po. And another thing that's a big problem, uh, syempre hindi nyo naman kasalanan, Pero sa LGU po, nakatoka na yung second dose eh. So talaga nakapangalan sa inyo yon. So I do not know what they will do with the second dose if you don't come. Pero again, kung may nararamdaman po kayo, you should not go talaga. May nagtanong sa akin, Doktora, if we miss the second dose, babalik ho ba kami sa first dose? So dapat 3. Hindi po. If you miss the second dose lang po ang ibibigay sa inyo. So Ma'am Cindy, I hope I answered the question.
From Mr. Mark Justin Miranda Batuhan, Doktora, what are your thoughts on the mindset of other Filipinos who do not believe in COVID and claim that it is simply a business?
Nako, Sir Mark, malungkot ito.
Malungkot.
Yeah, it's sad, because especially for those of us who have lost relatives, close friends. Ako po, I lost two cousins. And then, my best friend was also not treated. She was COVID negative, pero sa gulo po nung unang lockdown, she had breast cancer. I think it contributed talaga. Yung confusion talaga doon contributed to what happened to her. Namatay din po yung tao in the midst of the first lockdown. And I miss her terribly. So, sa akin po, it's very hurtful. Yun lang po. And I just hope and pray na these people na may sinabi pong hindi maganda, hindi po mangyari sa kanila yung sinabi nila. Ikaw, Reyna, any thoughts?
Dok, ito lang masasabi ko. COVID is really, really, really real. And vaccine is super real. Totoo po yun. Yun lang masasabi ko.
Yun na nga. Marami pong hindi kumikibo, but they or their families, friends have been personally affected.
Yes.
Sana po kung yun ho yung kinakalat nyo, it doesn't happen to you. Kasi pag nangyari na po sa inyo yun, napakalungkot po. And siguro that's the time you will realize yung mali po or the hurtfulness that you have caused to other people. Ayoko sabihin mali kayo, yun ang iniisip mo eh. Pero if it would happen to you, baka dun ho kayo matauhan na you have hurt a lot of people po in the process. At masakit po yun.
Yeah, Doc, and to add lang ha, totoo ang vaccine, totoo siya. Just to add, not to argue with anyone. Totoo ang vaccine. Malaki ang pasasalamat namin sa vaccine. Sobra.
Yun na nga po. I personally also have titos and titas who are in their 80s who got sick and they really credit po Sinovac for saving their lives. So, yun lang po.
Okay, next.
And Mark, I just talk to them kung talagang in a calm manner, kung pwede, yung kalma lang. At kung hindi na po sila talaga maniniwala, I would just leave them and pray for them. Yun na lang po.
Oo. Kung ako lang, Doc, dagdag ko lang. Kung hindi kayo maniwala, okay lang. Pero wag na kayong mandamay ng ibang tao.
Manahimik kayo dyan sa bahay nyo.
Just keep it to yourself. Wag niya kayong mag-encourage na, naku, hindi yan Kasi sa totoo lang, iba pag tumama sa'yo. It's just a matter of time. Really, Doc, di ba? It's just a matter of time.
Oo, talagang laganap na po ang Delta. Yun lang ang masasabi ko. It is a matter of time.
Yeah. Okay, next. From one of our viewers, totoo po ba ang efficacy ng COVID vaccine ay 6 to 8 months lang?
Ma'am, no, that's not true and it cannot be said. We are still studying these issues. But again, what I could tell you is pwede pong magbago ang science. So again, get yourself vaccinated, wear a mask, socially distance, and wait for further news from reliable sources. So, yun lang po.
From Miss Seth Bamba Manansala, Doktora, may thalassemia po ako. Need ko po ba ng magpa-flu vaccine yearly? Thank you po and
Yes,
God bless.
ma'am. Whether or not you have thalassemia, it doesn't matter if you have thalassemia or not. It is highly recommended po for everyone to have a flu vaccine yearly. Ngayon po, I don't know whether you have minor or major thalassemia. What is thalassemia? Yun po yung it's an inherited disease that causes anemia in persons. Meron pong minor, meron pong major. Since you have a blood disease po, I'm presuming minor, no? Kasi kung major po yun, sinasalinan po kayo monthly. I'm presuming minor, it would be a good idea po for you to have the flu vaccine yearly, yes. But whether or not, kahit na meron o walang thalassemia, maganda pa rin hong magpa-flu vaccine. Pero kung may thalassemia kayo, siguro mas better pa po. Okay, thanks for asking po.
From Ms. Loida Liandico Diaz, I got my J&J vaccine July 26, 2021. Can I get a flu vaccine, Doc? Thank you.
Yes, ma'am, you can. I normally recommend 2 weeks interval po between the flu and the COVID vaccine. Lalo na kung natapos na yung COVID, then you're thinking about flu, magpalugit lang. There's no naman need na the day after is susunod. So, okay na po yung 1 month, 2 weeks, ganun po. Okay?
From Ms. Edby Baby L. Canceran, if fully vaccinated na last August 24, 2021 ng anti-COVID, kailan pwedeng magpa-flu vaccine and anti-pneumonia vaccine?
Ma'am, 2 weeks, I would say. Magpalugit po ng 2 weeks. 2 weeks to a month.
Okay, from Mr. Mark Justin Miranda Batuhan. Correct, tama po. Kasabay ng pandemic, ang infodemic. Very well said po.
Nako, Sir Mark. Merong infodemic, meron. Baka mas grabe pa kaysa sa pandemic. At saka yung politics demic, meron din. Oh my gosh. Yung mga namumulitika sa, yung pinulitika yung pandemic, guys, wag. This is a science issue, it's a health issue, and it's an issue that affects our entire country. So tama po yun. Yung infodemic, sandali ito lang every person has a job sa infodemic, wag lang pong share ng share, mag-isip po muna kasi yung mga post po natin can affect other persons at baka po makasama pa. Okay? So if somebody sends you something na hindi po maganda or nakaka-nervyos or please ask saan po nila nakuha. Halimbawa, linagay nila maraming namatay sa bakuna. Sino po yung mga taong yon? Pakilagay lang po yung mga pangalan. Basically, don't accept all the informations that you get from other persons and then immediately share. Kailangan din po ng pag-iisip po and try to ask them saan po nanggaling itong balitang ito. Okay? Thank you, Sir Mark.
Okay, from Ms. Gemma Abaricio Saturay. Doktora, may bakuna ng J&J. Pwede pa I think natanong na po ito. Next
yes, Ma'am Gemma. That's okay. Yes, you can get vaccinated. Just give them 2 weeks to a month po.
Okay, next po from Ms. Janet Layo Garcia. Good morning po. Doktora, nagpa-vaccine po ako noong July ng Janssen. Ilang months po ba bago ako pwedeng magpa-flu vaccine?
Ma'am, today pwede na po.
Okay. From Ms. Dina Gonzaga, na-vaccine na po ako, Doc J&J last July 28. Pwede po ba akong magpa-flu vaccine? Losartan po ang maintenance ko.
This is actually a good question though it asks. Ma'am, pwede na po, no? I said 2 weeks to a month. And then, you can get a flu vaccine. It doesn't matter po kung high blood po kayo or what. In fact, it's better pa nga ho. Losartan is for high blood. It's better pa nga po na magpabakuna kayo ng flu if you have high blood. Kasi mahirap pong, halimbawa po, magkasakit pa kayo ng flu, then high blood po kayo. Nagsasama-sama ho yung mga sakit. Okay? So yes, please get vaccinated. Go na.
From another viewer, ilang weeks ang interval ng pneumonia vaccine and flu vaccine?
May nagtanong din sa akin ito, empleyado ko pa. At sabi ko, gusto daw niya sabay. Sabi ko, bakit ka nagmamadali? 2 weeks. Opo. Bakit hindi dapat pagsabayin, ano? Kasi po, we don't know kung magkakaroon kayo ng side effects sa pneumonia. Hindi rin po natin alam na magkaka-side effects kayo sa flu. Baka wala naman. Pero what if you got the two side effects? Eh, di talagang baldado kayo. So, please, mahina kalaban, isa-isa lang. Okay? Wala pong masama to wait.
From Miss Janet Layo Garcia, Doktora, ang apo ko po G6PD po siya. Okay lang po ba na ipa-flu vaccine?
Ma'am, I haven't heard anything about G6PD not getting the flu vaccine. Pero the best thing po is to consult the pediatrician po ng inyong apo.
From Miss Evelyn Lozano Villavicencio, Doktora, ano po ang difference ng flu at pneumonia vaccine?
Wait lang po Magkaiba po yung sakit niyan. Opo. Magkaiba po ang sakit ng flu and pneumonia. Pneumonia is bacterial and flu po is viral. So these are different diseases. Pero they are both not good to hindi mo maganda na magkasakit. So iba po ang protection ng flu at iba po ang protection po ng pneumonia vaccine. Okay?
From Miss Marilyn De Jesus Cortez, hi po. Bakit po ina-associate ng ibang taong pagkamatay ng ilan sa COVID vaccine? After daw po nagpa-vaccine, ilang araw namatay. Ano po pwedeng dahilan? Naku!
Ma'am Marilyn, we missed you a lot and thanks for joining us. Sino po yung namatay? Is the first, when you ask these questions, when you receive news like this from people, namatay si ganito sa COVID vaccine. First question, saan po nanggaling itong balitan to? Is it DOH, Philippine Daily Inquirer, Rappler po? Or is it a random person po na naglagay na maraming namatay from the flu vaccine, from the COVID vaccine? Second, name, address, and telephone number. Sa Pilipinas po, kasi there is a reporting process. Yung FDA po will investigate personally. Pupunta po yung mga doktor po sa bahay po ng namatayan to personally investigate the reason po na namatay po ang taong ito. So, if you have personal knowledge, not Ma'am Marlene, but anybody, kung may kilala po kayo na bakunahan and drop dead the next day, kailangan pong i-report ito to our government because we will go there and investigate po this issue. And number 3, balikan po natin yung tanong, bakit sinasabi ng mga tao? Yun ba yung tanong?
Okay.
Bakit in-associate ng ibang taong pagkamatay ng ilan sa COVID vaccine? Kung minsan po, ma'am, it's really, baka naman coincidence po, lumabas sa, ang problema kasi ng mga tao, eto lang honestly, every day, may namamatay, kasi every day, meron pong pinanganganak. Okay? So, people have to die, otherwise the world will become overpopulated. So, sometimes, kamalasang palad, there's such a thing called coincidence. Halimbawa po, may diabetes po yung mama. And then, nakadialysis na po, no? And then, sa sobrang excited po na mababakunahan na po siya, pumunta po siya dun sa vaccine center without drinking the gamots of the high blood and the diabetes. So, bibigyan na rin natin ng masamang heart problem kasi anyone naman ng diabetes and dialysis may heart problem. So after nabakunahan, dahil hindi po uminom ng gamot, he dropped dead. So hindi po dahil sa bakuna yon, it's because he didn't drink his gamots. So kuminsan talaga people, it can be may namamatay ho talaga every day. Especially po of various diseases. So, kailangan po talaga, and this is the reason po for the investigators. The government will really go po to your house, get the name po of your daddy, your mommy, your lolo, your lola, and then talaga pong, kung kailangan pa pong pa-autopsy po ng gobyerno yun, gagawin po nila yon just to find out po what really happened. So, sometimes maganda lang kung mag-click ng mga share, but the question is, na-report na po ba ito? And number two is, baka naman ho hindi lang po talaga matanggap po nung pamilya na may nangyari po talaga. Baka mahina naman ho talaga yung puso po ni Lolo and it just coincidence. So, mahirap po talaga eh. My best advice talaga is to identify who died, to find out po the circumstances why they died, to report this to the government, and number four po, to wait for the official report of the government. Kung wala naman pong ganun, parang ang hirap pong sabihin na dahil po sa bakuna. Yun lang po. I don't know why they associate it. Maybe they're sad. Hindi ko po alam. Pero please don't do that unless you're really, really sure. Kasi po, konsyensya nyo rin po yung lahat ng mamamatay ng COVID because you spread the wrong news. So, I don't know, ma'am. I hope they don't do that.
Okay, from Miss Gloria Del Rosario and Cabo. Good day po, Doc. Okay lang po ba na magpa-COVID vaccine na ako kahit may maintenance akong seritide inhaler para sa asthma ko at nagagamot din po ako sa fatty liver ko. Salamat po.
Ma'am Gloria, dalawa na po ang tama nyo. You have asthma and you have a liver problem. Hindi lang po okay, dapat. Kasi po, pag sinagsama-sama yan, lahat ng problema nyo, plus dagdagan natin ng COVID, talaga pong mas magiging grabe po yung mangyayari sa inyo. So you are not only okay to be vaccinated, but you need to be vaccinated for your own safety po talaga. Okay? So don't be afraid. Kung nininervous po kayo, get a clearance po from your doctor. Okay? I-share ko lang yung pinsan ko, baka hindi nyo makayanan to, no? But my cousin, she has breast cancer for 10 years. She has water in her lungs. She has breast cancer in her lungs. She has breast cancer in her liver. She's receiving katakot-takot na chemo and she also received Sinovac. So hanggat mapantayan nyo yung dami ng problema ng taong yun, dapat po magpabakuna rin kayo. So actually, she should be considered a hero for her courage to go forward po despite all of the things that are happening to her. Gusto pa rin ho niyang mabuhay at lumalaban po siya. Ikaw, Reyna, what do you think? 'Di ba? Grabe. Daming sakit pero talagang fight.
Yeah, that's a woman. I mean,
Grabe.
Courage.
Oo.
Grabe.
Yeah, courage and bravery. Yung mga taong ganun, doon na lang sa bahay, di na ako lalabas, mamatay na rin ako. All of this sad stuff. Ay, nako, fight. After na bakunahan, and you know what she did? She went to the beach. Okay, so, okay, galing. Galing talaga. She wants to be a private person na naintindihan ko. Pero, talaga inspirational yun sa akin, Reyna. Plus, may mga 104 years old na nabakunahan. So, siguro hindi naman ho tayo 104. Go, ma'am, go. Okay, kaya mo yan.
From Mr. Raymond Alan Sese, Doktora, pwede po bang i-obligate ng employer si employee na magpa-vaccine? Provided na meron vaccine. Kasi po, ibang employees, ayaw nila kahit meron nang nagpasa ng document and may QR code na done by the employer. Napakagandang question.
This is such a beautiful question and it's really, really, really difficult, okay? Siguro, the employer, sa akin ayoko muna ng sapilitan. Siguro talagang educational drive, talagang isa-isahin po natin talaga yung ayaw magpabakuna. But isipin mo yon, Reyna, what if you're working in a hospital and your lola is there for, let's say, breast cancer. Tapos nalaman mo na yung nurse ng lola mo hindi bakunado sa COVID. Ano kaya mararamdaman mo? Ikaw, Reyna. Ako baka maiyak ako eh. So, especially for people who work in nursing homes and hospitals, talagang grabe, kailangan po talaga to. And then, for people po who work in regular offices, talagang napakahirap. Kasi ako po, sa US, meron na pong vaccine mandates. And I think we are moving towards that. Kasi, for example, you're a flight stewardess, no? And then, iniikutan mo yung 100 persons inside the airplane and then alam po nila na hindi ka bakunado. Ano kaya mararamdaman po ng mga passengers and what will happen if somebody gets sick? Matindi po yun. And also in an office, for example, what if you don't want to be vaccinated, then somebody else in the office got sick, and then kahit na bakunado kasi you can still get sick, and then their lola got sick and died. Paano yun? Ang hirap talaga. It's really difficult. So I'd really start po with an educational ano talaga. Make sure that it's free, pero talagang kung ayaw po, ang hirap, ang hirap. That's all I can say. Ang hirap. Okay, next question po.
From Mr. Tot Pineda, watching po from Barangay Santa Rosario, Pau. Karen Pineda.
Ay, Kapitana, I know this lady. How are you po? Thanks for joining and watching. Sana po lahat po ng seniors sa PAO are moving towards vaccination na po.
From Miss Darlene Lindog. Hello, Doktora. Watching from Minalim, Pampanga. God bless po.
Hi, Ma'am Darlene. How are you po?
From Miss Enrique Ramon Henry Chichoco. Watching here at Paniki, Tarlac.
Sir, how are you po dyan sa Tarlac? Ayan. Puro mga bati na lang. Let's just greet them para happy naman tayo, para happy rin sila. But more happy ako kasi I like being greeted.
From Mr. Nicolas Caragan. Good morning, Doc. Watching from QC.
Hi, Sir Nicolas. Kumusta po kayo?
From Miss Luke Larin. Good AM po, Doktora. Luke Larin from Muntinlupa City.
Hi, Ma'am. Kumusta po sa Muntinlupa?
From Misette Bamba Manansala. Maya Papak, Doktora. Watching from Sapang Pari, San Roque, Macabebe.
Reyna, you're murdering the Kapampangan language.
Sorry,
Maya Papak.
Trying my best.
Ano ba province mo, Rains?
Manila, Doktora. Tagalog talaga.
From Sampaloc ba talaga?
Yes,
Where are you from ba?
Pero malayong ancestor na si Daddy's from Pangasinan. Yung lolo't lola. And then mommy's relative are from Bulacan.
Oo, pero talagang from Manila na kayo. Oo.
Yes po. Sorry po sa mga Kapampangan. I'm trying my very, very best.
Well, actually, in fairness ha, nung si Ma'am Nicole, si Ma'am Nadine, Gadja Casino, ninervous din ako kasi may nagtanong sa Bisaya and I had to send an SOS to Dr. June Ruiz. Tawa sila ng tawa. And my classmate who grew up in Iligan was watching pala and said, we not only murdered the Kapampangan language, but we also murdered Bisaya. Sorry, Ma'am Nadine.
Na po. Okay, from Miss Jesusa Lara Reodica. Kapag may sipon po ba, need agad magpa-antigen test? Actually, magandang question to, Doktor.
This is really a good question. Ma'am Jesusa, my advice to you, kung may sipon po kayo, do not test. Isolate yourself. Stay in your house for 14 days. Kung marami pong lumalabas sa bahay nyo, and then observe kung may nagkakasakit pa sa bahay. If biglang nagkasipon kayo, then your asawa got sipon, then the kids got sipon, wag na po kayong lalabas ng bahay. That's probably the best advice that I get. When should you test? Sa akin you should not test immediately. You should test if someone needs to go to the hospital or kung sakaling may ibang nangyari. But if it's all mild and everyone is sick at home, it's okay po to just stay at home. But again, walang lalabas ng bahay and I would suggest you report it to the barangay.
Doktora, gusto ko yung advice mo. Napakagandang advice na nakuha ko. Dahil sinabi niyo po dito na huwag kayo agad-agad magpapates. Totoo po. Kasi
yes, huwag kayong
Thank you for saying that, Doktora.
Yeah, huwag kayong agad magpapatest. I mean, it's not 100% absolute necessity. The 100% absolute necessity is to stay in your house. Ngayon, if things are not going well, halimbawa, parang hindi na maganda yung situation, you may opt to get tested. You may also opt to have a telemedicine consult. Pero kung may nilagnat po or sinipon, you may opt not to test. If you want to get tested, marami naman pera, wala naman pong masama. But again, if the test is positive, you need to stay in your house. If the test is negative, kung talaga pong mukhang COVID ang dating, you still should not leave your house even if it is negative. Kasi there have been cases na negative po yung test kasi as I mentioned to you, no, the test only becomes positive between days 5 to 9. So baka ho na-test kayo on day 3. Then you go wandering around kasi negative. So yun po yung masama. If you really think it's COVID, just stay in your house.
From Miss Leia Gatbonton. Thank you po, Doktora, sa mga advices.
Thanks, Ma'am Leia. Thank you also for watching. Okay. Are we okay with that? So sa inyo po lahat,
yes.
it's a little past 12. And thank you so much. From Jesusa, thank you na lang. You're a blessing. Wow, Ma'am. Sarap. Thanks so much. So sa inyo po lahat, last words on boosters. Right now po, it is not yet recommended. Number 2, don't get a booster by yourself, okay? Kasi baka kung may mangyari. Ano kung sasabihin natin sa emergency room pag na-allergy kayo or what, you caused that problem by yourself, okay? Number 3, again, what you should do is get yourself vaccinated twice. Once po kung J&J, continue to wear a mask, face shield, and socially distance. And number 4 po, just wait for further advices po from our expert scientists. So yun lang po and magandang hapon po sa inyo lahat. Thanks so much.